Hello, sir. Good evening. My name is Kira Amir, and tonight we'll be tackling about what tonsillitis is. Okay, so this is the introduction of tonsillitis. Tonsillitis is an infection or inflammation of tonsillitis which are located at the back of your throat. It is often caused by viral infections like common cold or flu. So, did you know that chocolate itself does not affect tonsillitis, but it can worsen symptoms or irritate the throat that has already affected. So, pwede na tayong mukaon og daghan king chocolate. Okay? So, ano man ta mag-ingon nga ang chocolate ang cause sa tonsillitis? You see, chocolate is often high in sugar. This means that it can weak our immune system's response and encourage bacterial growth in the tonsil. Especially the milk chocolate kay tungod mas tamis siya so mas daghan ang sugar nga iyahang gina-produce. So the cause of the tonsillitis is not the chocolate. Next, we have the learning objectives. We have by the end of the lesson, the patient will be able to assess understanding of basic anatomy and physiology of the tonsillitis, assess prior knowledge of cause of tonsils, explain the pathophysiology behind tonsillitis and its effect on the body. Explore the signs and symptoms of tonsillitis, identify and discuss the tonsillitis triggers, including lifestyle factors. Evaluate the management strategies for tonsillitis, focusing on preventing care and home remedies. And lastly, demonstrate preventive measures and lifestyle changes to reduce the risk of tonsillitis. Now, let's proceed to the anatomy. Kung sa man yung anatomy, nakay idea what is anatomy? Okay, when we say anatomy, it is what and where they are located. So let me zoom in this. Please look at the kanina part. We can see here the pharyngeal tonsil, the palatine tonsil, and the lingual tonsil. So we have three tonsils. Diba sa tag-ingon nga, nagbubag akong tonsil, sakit yung tonsil. But what we are actually referring to is not just one tonsil, but the palatine tonsil at the back of our throat. This pharyngeal tonsil is kanang sa taas good, muna siya ang behind sa atong nose. We can see that actually. And also, we can also see the lingual tonsil. Kaya na siya sa back of our tongue, bali the end of our tongue. Tonsils are two soft oval-shaped tissues at the back of your throat. So, pag di ba, makita mo sa kilid. That is the tonsil nga atong gina-refer, but it is actually called palatine tonsil. Those are lymph node tissues. When we say lymph node, di ba ato kabalaan kay, di ba natay lymphoid system. Lymphoid system mo na siya ang or the lymphatic system mo na siya ang sila ang major nga naga-protect sa atong body. Sila ang responsible for the body's protection. So basically, since the tonsils nato is lymphoid tissues siya, part siya sa lymphatic system. So, dito na mabalaan sa ilang purpose. Let's proceed to the physiology of that tonsil. Any idea what is physiology? What does physiology mean? Okay.
Wala, ma'am.
When we say physiology, it is what they do. So basically, unsay pulos aning tonsil. Okay? The tonsils are part of the immune system as what we have talked earlier. Their main job is to what? To trap and fight bacteria and viruses that enter through our mouth and nose. And ba itong pharyngeal tonsil is at the back of our nose. So, kana din masulod sa itong mga bakbak, mga virus kasi tag ha 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 ha. Di tagsulod sa mga taong manay ubo, naisipon, mapasa sa ato ang mga sakit-sakit, ang mga virus na tayo, coronavirus na tatungod na sa ato ang tonsil nga nag-weak. So in order na dapat na dili mag-weak atong tonsil, dapat dili ta magkaon og mga bagay nga magpa-weak sa ato ang tonsil because their main job is to unsa gani to protect and fight bacteria and viruses that enters our mouth and our nose. They produce white blood cells and antibodies to help protect your body. Muna sila ang mga factors yun yung mag-protect sa itong body, the white blood cells and the antibodies. Especially during childbirth when your immune system is still learning. So let's proceed with diagram of the tonsil. As you can see here in the left side, we have the normal tonsillitis. I know, normal tonsil rather. You can see here the uvula, the pharynx, and the soft palate and the normal tonsil. While on the right side, we have the throat redness, of course, since it is already inflamed and it has already bacteria there. The whitish spots na makita nato sa ato ang tonsil nga nag-inflame, and the swollen tonsils, of course, gets.
Yes, ma'am.
Very good. Now let's proceed to the common causes of tonsillitis. As we have mentioned earlier, the causes of the tonsillitis is not the chocolate. Rather, the chocolate is what triggers the inflamed tonsils. Okay, so we have viral or virus, bacterial, and other causes. Viral causes, common virus like common cold, flu, and Epstein-Barr virus. Muna yung mentioned earlier na ano yung time na magsalimuha sa taas sa tao, tapos na sa utak, abo na sila yung mga virus, yung ubo-ubo na sila sipon-sipon. So, kita po matakdan po ta silang virus. The second is the bacterial causes. The most common bacterial cause is the Streptococcus pyogenes, the group A strep, which can lead to strep throat. Okay, and then lastly, the last cause that may cause tonsillitis is the allergies, irritants like smoke, and environmental factors. Okay, when we say environmental factors, it may include kung nakaka sa imong school o niya ang imong school kay kanang daghan og mga taong nagsakit or mga taong ospital or basta init kaayo tapos nag-inflame na imong tutunan kay wa ka naga-drink og water. Okay, let's proceed with the pathophysiology behind tonsillitis. Kung sa man nag-occur ang tonsillitis? Tonsillitis occurs when the tonsils became infected and inflamed. When the tonsils fight an infection, they produce white blood cells and antibodies to help clear the invading pathogens. This leads to the characteristic symptoms of tonsillitis. So, mo ang reason nga nag-inflame ang ato ang tonsillitis mo na nagahubag siya is because naga-release siya of white blood cells and antibodies nga mag-protect sa atong body. Kay tungod na may bacteria ang ato ang tutunlan. So, ga-release siya og mga antibodies nga mag-help og fight sa bacteria and virus. The inflammation can cause swelling, difficulty swallowing, fever, and sore throat. Okay, the tonsils may appear red and swollen, and in bacterial cases, pus may also be visible on the tonsils. Now let's proceed to the common symptoms. As we have tackled last meeting when I interviewed you, we talked about your symptoms, right? Your symptoms was sore throat, which is indicated here, sore throat, difficulty swallowing, and a fever, right? Right. But we also have bad breath or halitosis and ear pain or discomfort. Have you ever tried having ear pain or discomfort when having tonsillitis?
Yes, ma'am.
Ah,
Yes.
yes. Yes, that's normal because that's the common symptoms of tonsillitis. Now let's proceed the factors that can trigger tonsillitis. As we have mentioned earlier, of course, we have this. Do you know this? Do you
Chocolate
know this?
consumption.
Yes,
Chocolate.
chocolate consumption. This is the first thing that can trigger the tonsillitis. Why? because chocolate again can weaken our immune system. And if ma-weak atong immune system, dali lang ta masudan og mga bacteria and viruses mo na mag-inflame ang atoang tonsil. When chocolate itself does not cause, di ba? It does not cause tonsillitis. It can trigger for some individuals due to its ability to irritate throat and promote mucus production. The second, do you do this, sir? Ay, nawala siya. Arit, do you do this?
No po.
Okay, that's good
Dili
here.
ko panigarilyo.
Huh?
Dili ko ka panigarilyo.
Tama. That's good. Ayaw jud panigarilyo. Okay? Since prone pa naman ka
Amen.
sa tonsil, di ko pwede magsigarilyo. Anyways, back to the topic. We have smoking, pollution, and dry air can irritate the tonsil, making them more susceptible to infection. Di ba? We talked earlier about the environmental factors. Di ba? Pag-init kayong hangin, tapos ang pollution, tapos kapito kang biyahe. So that can cause irritation to your tonsils, especially if you're not hydrated enough. Now, one reason of having tonsillitis, of course, is having weak immune system. First, that can weaken your immune system is poor diet. Are you eating regularly?
2 times a day.
Do you sleep 8 hours a day?
No, ma'am. Dili na ako sa mama.
Okay. And also, stress can weaken the immune system, increasing the likelihood of developing tonsillitis. So, muna itong mga factors nga magpa-weaken sa atong immune system, which makes the pathogens or the bacterial and viruses enter our body more easily. Now, let's proceed to this infographic we have here. Joke. No judge. Anyways, we have here the symptoms, okay? Inflamed versus not inflamed tonsils. As you can see here, the symptoms are fever, foul breath, sore throat, dysphagia. The pathology, etiology, the causes of the
Di
tonsillitis
mga
is a
tanaman.
yes.
Pwede mag-ask.
Yes.
Makabaho na ba ang tonsil?
Yes, of course. Yes, sir. It can cause halitosis
Ngano?
because the virus in our sorry, di ba mag-inflame siya. Mag-inflame ang ato ang atong tonsil. And ang kanang mga virus and bacteria kay natipok siya sa ato ang tonsil. And mo nang cause sa atong bad breath tungod sa tonsillitis kay tungod sa bacteria. Okay? Did that answer your question? Yes, no.
Okay.
Okay. We also have the prevention. To reduce your risk of developing tonsillitis, you should wash your hands often, especially before touching your nose or your mouth. Di ta pasig pangulito, pasig pangulito. We have to wash our hands first. Okay? Second is to avoid sharing food, drink, or
Mm.
utensils with someone sick. Okay? This can cause ano po, kanang magtakod-takod. So kapag naisakit ang tao, dapat dili to gamiton ilang gamit. Kay matakdan po ta sa ilang sakit. And third, to prevent tonsillitis, we have to change our toothbrush regularly. Okay? How many months do you change your brush?
Every day.
Every day?
Yes.
Wow, you have lots of money. You have a toothbrush, B? Okay. That was a joke.
Bagong
Anyways, let's proceed,
refresh.
sir. We have here the home remedies. Wow, we are almost done. We have home remedies that can help you ease your sore throat. We have here sore throat, and this will help you soothe your sore throat. You may ask your family members, your girlfriend, your nana, your daughter, brother, sister, anywhere in the world to ask them to make you hot water plus honey plus lemon juice. We also have hot milk, ground cinnamon plus powdered ginger plus honey. We also have hot water plus orange zest plus cinnamon stick and hot milk plus ground turmeric plus cinnamon stick plus honey plus whole black pepper. This can ease your sore throat. Also, you may gargle with salt, get plenty of rest, increase your fluid intake. So, kailangan mo mag-drink of daghan water and consume soft and cold foods. Kapag mag-experience ka ng tonsillitis, you have to consume mga foods nga dili kayo maka cause of irritation sa imong inflamed tonsils. Stay away from cigarette smoke, over-the-counter treatment, and consume honey to aid. Now we have the preventing tonsillitis involves strengthening the immune system, avoiding triggers. First is the diet and a lifestyle. You have to maintain a balanced diet, ensure adequate hydration, and avoid irritants like smoke and chocolate if sensitive. If makafeel na ka nga, ala, murag, nagkatulong-tutulong niya, mura na kag mag-tonsillitis. Please avoid triggers. You still remember the triggers that we have discussed earlier? Sir, you still remember the chocolates? It can cause irritation. Second, to prevent tonsillitis, you also have hygiene. Practicing good oral hygiene, including brushing your teeth regularly, using the mouthwash, and gargling salt water can help prevent tonsillitis. Of course, lastly, when we experience tonsillitis, we have to rest. Okay? Kapag mag-experience ng tonsillitis, kapag nag-fever na ta, dapat ito sa may lakaw-lakaw, di ka kasi sa baron, dapat we have to rest and manage our stress. Get enough of sleep. Okay? Get enough of sleep. Rest. Tulog, tulog, tulog. Okay? Now, if ever mag-crave man ka og sweets, we also have alternative sweets. We have no sugar fruits. Makita naman dara. Makita naman. Makita naman.
Ah,
Ang kani mga alternative sweets. Okay. You may
ay
eat
dili.
this if ever mag-crave ka og something sweet. Kay pwede siya maka-cause of irritation sa imong tonsils. We have avocado, strawberries, blueberries, raspberries, blackberries, cranberries, lemons, kiwi, watermelon, cantaloupe, peaches, grapefruit, apricots, plums, oranges, and pineapple. We also have 15 healthy snacks ideas. We have, okay, nawala na siya sa atong PPT. But anyways, I'll just, piece of fruit, trail mix, we have veggies and hummus, we have cheese and crackers, fruits and smoothies, frozen banana bites, apple slices with peanut butter, oatmeal cookies, avocado toast, fruit salad, homemade granola bars. Okay, that would be the end of our discussion. But before we end, I'll have you to answer this. Our game tonight is this or that activity. Ready? Ready or not?
Ready.
Okay. Ready ka? Okay, number one. This or that.
This.
Whoa, why? 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 Why did you choose this?
Na may fruit.
Okay. Number two.
This.
Wow,
Oh,
very good choice. Ano, wala siya. Okay, number three.
this. Again.
Wow, very good. Number four.
This.
Wow, that's good. Ari,
This.
nga naman.
Gummy man na. Gummy bear man na. Gummy candy man na. That. So, mas ako, nawag chance nga matansil ka kay tamis kayo sa katanan.
Wow, so you've learned from our discussion. What about this?
That.
Why?
Fruits.
Okay. Next is this.
This.
Personally, I chose that. Anyways. Next question.
So, na.
Okay, let's zoom in. Cucumber with rice, carrots, and
Sige, this
cheese.
na lang.
This na lang. You don't want to choose this? This, ito? This one? I don't want
Makatansil
to.
man na.
Ay, okay, fine. Now, what about this one? This or that?
This.
Very good. Let's proceed with this or that.
This.
I like the stars. Haha. Okay, so that would be all. Thank you so much for your cooperation. I hope that you have finally learned what to choose, what to do with your tonsillitis whenever it occurs, and of course, how you would manage it. Thank you.